the hepatitis B vaccine. Is it necessary? Let's talk about it. Hi, I'm Katie the PA, and I talk all things conventional and crunchy. Let's go through the risks of the hepatitis B disease versus the hepatitis B vaccine. So what is hepatitis B? It's a virus that is usually contracted through IV drug use or sexual activity, or from infected mother to child, or if that child comes into contact with any blood or bodily fluids of somebody else who's infected. Symptoms of hepatitis B are kind of funky because they can be acute or chronic. So about 1 to 3 months after exposure, you can develop fever, nausea, vomiting, digestive issues. But chronically speaking, even years down the line, you can develop just chronic fatigue, jaundice, and then later even liver cirrhosis, cancer, and it can be fatal. You can die from this. Which is why it's important to talk about this vaccine, because it did actually decrease the rate of hepatitis B when it was put on the newborn schedule in the 1980s. Today, I want to talk about what is the risk of a child today developing a fatal hepatitis B infection. So when you go through the numbers, about 1% of mothers are infected with hepatitis B, and about 0.1 to 1% of mothers are carriers to hepatitis B, along with the normal risk of exposure. If you look at the numbers, people, the chances of a child, a newborn today, with normal exposure getting a fatal hepatitis B infection, get this, 1 in 7 million. 1 in 7 million, that's pretty rare. So now let's think about the vaccine. This vaccine is given at birth, literally hours after your kid is born, plus at 2 to 4 months and 6 months. Now, when you're looking at the side effects to this vaccine, one thing I think is pretty crazy, it's one of the main side effects, is liver inflammation. Kids under 6 are 2.9 times more likely to have liver inflammation, liver problems later on in life after getting the hepatitis B vaccine. Now, isn't that the thing we're trying to avoid here? Now, another main side effect of this vaccine that between 1 and 6% of kids get is a fever. Now, when a newborn child under 30 days gets a fever, this is considered an emergency. You are supposed to take your child to the ER if they have a fever, if they're under 30 days old. There are also studies in the UK and in New Zealand showing correlations with getting this vaccine and increased risk of type 1 diabetes and multiple sclerosis. Now, on top of all of that, there are studies correlating this vaccine with over 400 cases of sudden infant death syndrome, SIDS. Now, all of those things that I just mentioned happen at a higher rate than 1 in 7 million when you're thinking about the risk of a fatal hepatitis B infection. So you tell me, is the hepatitis B vaccine necessary? Let me know in the comments.